community station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
Welcome to Bobo 103.1 FM. It's Dane hanging out with you, back for a next session with HSA to talk about a very important topic. But for those that are just joining us for the first time, if you have never been a part of this show before, please note that it's all things HSA. So it is a show that's brought to you by HSA just before the BBC. And what we talk about is special occasions, days that need to be recognized like this, months that needs to be recognized like this segment that we're going to be talking about very soon, along with our special guest this afternoon. But also we talk about the heroes, the unseen heroes that work at HSA and the incredible work that they do in the background at this state-of-the-art medical institution. And today I am joined by the beautiful, I'm going to have her introduce herself. Good afternoon. How are you doing?
I'm very well, Dwayne, and thank you to Magic 91.5 for having us here today. And I am very pleased to represent the Behavioural Health Department at the Cayman Islands Hospital. My name is Dympna Carten. I'm a community psychiatric nurse of many years standing, both professionally and in the Cayman Islands. And I'm here today to talk about World Mental Health Day, with the focus being on mental health in humanitarian emergencies.
I struggle with it too, don't
I
worry.
almost had a little emergency there myself. But
same here.
Yeah, and to look at what we do at HSA to ensure that we take care of all people.
How long have you been doing this, you said?
Well, I've been doing the job, including my training. Well, for 40 years. I've been in psychiatry 40 years, and I've worked in Cayman for the last 29 years. Yeah. So at this point, I'm the longest standing psychiatric professional.
You've seen everything.
I have seen it all. I came here, in those days when we didn't even have an inpatient ward at the Health Services Authority, at Georgetown Hospital, as it was known in those days. I spent many days, many evenings, many weekends in the lockup and in the prisons, because unfortunately sometimes people were very, very unwell and they weren't well enough to be on medical ward. Wow. So we had to look after them in those facilities, and that was really tough. It was very hard to go into those environments, to see people who were already very, very distressed. We tried to make it better, but it was harder to leave them, when they're in that cell, drinking a little bit of sun through the bars in the window. It was difficult, but I'm pleased to say that we have come on a long way.
You have. I was going to talk to you about the evolution before we jumped into the topic of today, but the evolution of what you may have seen, you probably have witnessed this being something that was a little bit of a taboo, not talking about it, to not recognizing it or giving it a different name or making an excuse for it, to where you actually have now witnessed, after all the years, people actually putting a title to it, the right title, and seeking help.
Absolutely. And I think one of the greatest things that was done, actually, and it was just started before I came, so about 2 years prior to that, in about 1996, because we didn't have an inpatient facility, we were community focused, right? So we had one psychiatrist who was Dr. LaHaye at the time, but we had community psychiatric nurses who went out, they went into the communities, they assessed, they delivered care, and they treated people within their own homes. And the focus of that was to maintain people, to get them stable, for them to be well again. But the focus of being a community psychiatric nurse has not changed since then. We are the backbone of any good mental health foundation across a government facility, a public facility. And our aim is to really try and cut things off at the pass, keep people in their home, with their family, with their support, And I think that although we started out like that because of necessity, we have continued. And, the biggest change was in 1998, Cayman and the Sister Islands generally had been very much left out of the equation because they had a visiting psychiatrist. Dr. Leahy would visit once a month, but they didn't have that specialist nurse. So the first community psychiatric nurse took up residency on Cayman in 1998 and covered the Sister Islands. And I'm pleased to say that until this very, very day, we still have a community psychiatric nurse.
Good.
I am covering again because we're in a little bit of transit again. So, I'm there 2 days a week. But we also now have a full-time psychologist, Dr. Liesel Angeloff, who you met last month with myself. But so our team, even on the Sister Islands, is slowly growing. And of course, they cater to Little Cayman as well. So yes, we've seen huge changes. And overall, the team at the Health Services Authority, I would say, has really, I don't think it's just growing, it's exploded. We now have, we started off with one psychiatrist. We now have a number of psychiatrists. We have a number of psychologists. We have occupational therapists. We have ABAs, the community psychiatric nurses, the therapy assistants. These are all things that are a tremendous resource, but help to take care of people and look at people individually, because not everybody who becomes ill mentally needs to see a psychiatrist, right? Yeah. Or needs to see a psychologist. And, so we've been actually very good at building mental health into primary care. So, we work very closely with our general practitioners, and they're excellent at dealing with people who may have psychological or emotional needs. We've come a long way.
I love that. I love the evolution. I wanted to touch on that a little bit because I know how long you've been in it, and it's to kind of honor you too. Like, sticking it true has proven very fruitful. You're bearing fruit now because of that. Now, what is World Mental Health Day, and what is the theme this year?
Sure. So World Mental Health Day, it's an annual international day on the 10th of October that raises awareness about mental health issue. It mobilizes support for mental health and well-being, right? The day is dedicated to shining a light on the stigma surrounding mental illness and encouraging open conversations about mental health and to, raise awareness of the support that's available. So it's a really powerful reminder that there is no health without mental health, because as I like to say, Jane, everything starts from here up, right? Or here down. It starts there and it has to go down. Without our brains being active and fully functioning, we are not with the best physical health in the world. Yeah. If we don't have the motivation, right, the drive, the ability to see our needs, to understand our needs, it's not going to be very easy to put change in place or to deal with difficult situations when they come along.
Yeah, I agree. I 100% agree. And why is mental health, this is a very important question, by the way, but why is it a critical concern amongst humans like us, and particularly in the Caribbean? We talked about this earlier too. Why is it a big concern?
Why is mental health a big concern? Because, as I say, we cannot function without our mental health. You may look fantastic. You may be able to run, for 15 miles without stopping, right? But if you're not able to get up every morning, to be fruitful, right, to have purpose, to be able to recognize when you're struggling, to see when those struggles, emotionally or psychological, might be impacting your everyday activities, your work, your ability to be purposeful, your relationships with family, with friends, to be a part of society, to feel included. That is why mental health is so very important. And we put a lot of emphasis on physical health, and yes, they must go hand in hand together. They work simultaneously.
Yeah. It's so weird when you said that. Two things you said that I want to touch on. You said you can look like everything is okay. First person that popped in my head, and the only reason he popped into my head, Robin Williams, was because he was a funny guy.
Yeah.
Everything was about laughter. Everything was about joke. Forget about that he was rich.
Yeah.
He found a reason to be happy about everything. So in eyesight, if I was his friend, check up on me, Robin.
Yeah.
Like I have no reason to check up on you because you look perfectly fine.
Yeah.
And then you attach that with something else that you said that was also compelling, purpose.
Yeah.
Oh man, the people that don't wake up with purpose, that has to be a difficult day. If they do not wake up with forget the vision too. The purpose needs to be the first thing. What am I doing today?
Yeah.
Because there were
Exactly.
days, and just to be completely transparent, because it will be so wrong of me to do this interview and not be transparent about it. There were days that I was waking up wondering why my family would be better off without me. And it wasn't like people always say it's a selfish thing to
No,
think,
it's-
or that's the number one word they throw around. But I was honestly thinking about them first, so I can't be selfish because I was saying, no, they're better off without me. Yeah, of course, to you it may come across selfish, but I was thinking about them.
Yeah.
Do you see that a lot? I know it's not in this question sheet, but do you see that amongst
Yeah.
the people you speak to?
Sure, that people don't feel that they have purpose, that they have reason to be here. And that's actually a deep psychological and emotional pain, Dane. And, so it's important that we don't let that get out of hand, that we acknowledge it and that we become better able to address it. Now, you were able to do that because you could acknowledge the supports that you had around you, right? The reasons that you had to live, the reasons that things could be better. You had that hope, but not everybody's going to have that hope, right? And it's because of that they might do something that might end in a tragedy, So again, it's very important that we cut these things off the past, but it's about talking about them and sharing them.
Absolutely. Closer to home now, what kinds of human beings emergencies are we talking about here? How do they affect the Caribbean and the Cayman Islands in particular, like here, home base?
Sure.
And Sister Islands too, by the way.
That's right. We cannot forget our sister islands.
Absolutely.
Yeah. So emergencies, natural disasters can include large-scale displacement of people that can cause humanitarian crisis, right? That really affect people's lives, their homes, their social supports, their sense of security, right? And according to the World Health Organization, almost all people affected by some sort of emergency, on a large scale level, will experience some type of distress, right? Some type of emotional residue. But that doesn't mean to say it has to last, because often people will get through because based on who they are, what supports they have, what availability they have to help, and also how resilient they are. And we build resilience isn't something that we're necessarily born with, right?
Yeah.
It's something that we grow over time.
Absolutely.
So those are all important things to understand that, if a disaster does happen, it can affect people and it can lead to a mental health disorder or a condition, right?
Yeah. What are the consequences that we're talking about? It's in particularly, by the way, during an emergencies situations.
Yeah, so emergencies might be. I mean, if we think back to, we're the earthquake, right, of 2020. I mean, that really was something that for everybody who was on the islands, right, that affected us all. We all, I think, most people had some experience of that earthquake, and it did shake us to the core, both physically and mentally. It was frightening. We see the panic that unfolded on the roads because people were concerned about families, about loved ones, about their children's. So the roads got gridlocked, right? So, instead of sitting back and saying, okay, let's get some news from a reputable source on this to understand what the plan is, where the help is, and what we can do to move forward and get help to those who needed it. But actually, as a result of everybody panicking, it became an even bigger situation.
I remember that.
Yeah.
That was a bad day because you start to think in your mind all the worst things. Because I think what is it? 70% or 80% of those people were chasing after loved ones.
Yeah.
They were only leaving their workplace because of loved ones, right?
Yeah.
And that shuts you down in a complete different way.
But I have to say too, though, Dean, never underestimate yourself and your own capability to deal with these things.
Yeah.
Because I was actually quite shocked myself the day of that. I was in the office at the behavioral health department at the hospital, and I felt something, and I thought this, and I've been in earthquakes before, and I thought that's an earthquake. So at the top of my voice, and I'm not someone who would generally call out, who would shout, that's not my style. And I shouted, "Earthquake! Everybody down! Get underneath your desk!"
Yeah.
And everybody was, all the other, colleagues across the office were all down underneath their desks. So when we stopped shaking and, sort of calm, set back in again, I got up and walked out into the corridor, and there was my colleagues underneath their desks. And it was like, so we all knew it was something serious, and we took it serious, but I would have never thought that I could have been so measured in a situation like this.
Yeah.
So again, it's like, we have to understand ourselves and to know that, sometimes, we're better prepared than we think we are, right?
Yeah. And that is a very important information that you just gave, because during that, everybody has their story during that earthquake.
Yeah.
I found out who I was, and then I found out a little bit about my wife also, because for me, I did a little bit of aviation training. So we've always been told, when emergencies come about, we don't panic.
Yeah.
It's one of the number one things that we've been taught, right? Going straight into aviation school. But I realized when it happened, I automatically was just in like, okay, what do we do here type mode. I was more in like Papa Bear, protect everybody type mode.
Yeah.
My wife was completely different. She was panicking. It just kind of felt like the world was coming to an end and things are going to go terribly wrong and we need to deal with something now. For me, it was just about protect everyone, but do it in such a way where you don't allow them to panic too. It's going to be okay.
Yeah.
It's going to be all right. This is what we do. Don't do that. Do this.
Yeah.
So it's kind of hard to recognize. I don't know where I want to go with this, but I'm trying to say is that it's kind of hard to recognize if you can really say that somebody has a mental health problem based off of because am I allowed to say that my wife would have an issue because how she went on versus how I took that on? Do you get what I'm saying?
Yeah,
here,
I get what you're saying. But and that's what we have to be very careful about, right? Is not to sort of instantly diagnose people. She reacted in a way that was her way of protecting herself and her family, right? And dealing with it there and then. Now, if that was to continue into days and weeks and months of that sort of behavior, then we could say, okay, that has triggered something. And possibly then we might be looking at post-traumatic stress disorder. Yeah. But I think in the incident, we can't say that someone did such and such, and that's a reflection on their mental state and their ability to handle things.
No, sorry, go ahead.
Yeah, because, as I always say in these situations, you can never say never. You know why? Because you never know. You never, ever know how you're going to react in any situation. You might think you do, and you'll certainly have a plan, and you'll have a roll call in your mind, right, as to what you can do and how you can better manage it. And that would include even thinking of, like what help is available, what are the consequences of this, right? Yeah. This working out that plan. But when push comes to shove, you don't know, right? Yeah. Because you don't know what else could happen at exactly the same time.
Yeah, that is so true. I like that. Yeah. That's why we like having these conversations. Now, a really quick question before we go to a quick break. Are there any particular vulnerable groups that we must pay attention to in these emergencies? Because we just talked about the situation with my wife, but not to be careful. We have to be very careful that we're not calling people what they're not at this moment.
Exactly. And I want to say that these emergencies are not just earthquakes, but certainly what we have realized is that we are all better prepared now, right? Because this has happened. That wasn't the first. It hasn't been the last. But we are better prepared. But it's ongoing, systems like weather systems that we also have to be mindful of. And of course, we know about hurricanes. But we also have to be, we went through COVID. That was something that impacted the community. Yeah. But we also would have to look at maybe a major road accident, at something that would affect the airports, perhaps. Yeah. So there can be a number of things, but it all comes down to the same thing. Have a plan, think about these things. And in respect to vulnerable communities, yes, there's a number of people. So, obviously children spring to mind, right? So it's very important that we include them in our emergency plans. And this is exactly the right time to do this now, at the start of hurricane season, although we're climbing towards the end, but we're having some challenges at the minute, right? Because the current weather system. But, start with your children. Don't leave it to the last minute. Yeah. Make sure that they're involved. Elderly people, particularly elderly people who may be very able, right? Yeah. But living by themselves. Anybody who's gone through a recent bereavement, who's lost a loved one, and they have been in the house with them for maybe, it could have been 10 years, it could have been 50 years. It doesn't matter. It takes at least 2 years to properly get through a bereavement. And particularly if it's an older person and everybody else is left home and they're there by themselves, they're very vulnerable. So I would ask you that you please look out for your neighbours and friends. People in your community that may have special educational needs, right? Or may have some form of disability, whether it can be seen or unseen. Think about them. Who are they going to be with? What are their plans? And I would also say that, we have to be very mindful of people who are homeless. Yeah. We know we have a homeless population in the Cayman Islands. It may not be up in the hundreds, but it is there. I can tell you it is there. I know people who have been homeless, who, it's a current challenge for them. So we need to be mindful of them. The other group that people generally don't think about, right, is people who are in the prison system, who may be currently incarcerated, whether that be men or women. Now fortunately, the prison system is embedded in our National Emergency Operation Plan, and certainly in the hurricane plans and things like that. So the staff there and the director and his team are very good at looking to the psychological and emotional needs of the prisoners. But we need to think about the families of those people that are on the outside, check in with them, check in to see that they're okay, that they feel safe, because they're in a situation where they don't have choices, right? Yeah. They can't leave the prison. And I think that, after Ivan, one of the things that was most remarkable was that the female prison was very badly damaged. And at one point, the small population of female prisoners and the staff that were with them felt that they were the only people left on the islands because the weather was so bad, it was so devastating. And of course, it was starting to flood, and they made the decision that they had to leave. And get to higher ground, and they all did. They walked together in single file, holding on to each other. I remember dealing with them and coming in contact with them afterwards when I would be visiting. They were then at the male prison, and then subsequently got back, and hearing their stories and the impacts that experience had on them, was a very difficult journey. So, just think about them, if you're someone with, a loved one who is in prison, just make sure you reach out to them to let them know that you're safe, what plans you've made. Yeah. And also just to say, you're safe too. You are taken care of, you're thought about.
Absolutely.
So there's a number of people that we have to be aware of. And also, people with chronic and enduring mental health problems, right? Now, many of them are engaged in treatment and care. And of course, we as community psychiatric nurses, they would be very much embedded in our caseload. So one of the things that I'm always talking to my patients about and my colleagues sharing is that, where are you going to be if a storm hits? Now, they're a very determined group and a very independent group as well. And they feel like, no, we're grand. Nothing has ever happened to me in the past. So I'll be okay. And I say, no, you don't know. And I also want to say on that note too, that anybody who's new to the island and has maybe never experienced any sort of natural disaster or been through a hurricane or a bad storm and is on their own, this is not a time for heroes, right? You don't see anybody out there in capes during these storms. You should not be on your own. To anybody, actually, you should not be on your own, because it's not the effects of the weather necessarily. Medical emergencies will happen during storms, right? Yeah. People will slip. They will trip. They could be eating something and choke, which is why I always say no one should ever eat alone, because you could choke, and who's going to save you? So I encourage people, and I know that in storms in the past, we've had calls that have come in to the hospital, to the call takers at hazard management, even to Cayman, the mental health helpline. And it's people who are on their own, and they're saying, I'm really frightened, and they're scared. Emotionally, they're scared. They have a window of opportunity sometimes to get to someone, but sometimes they've left it too late, and they have to go through this alone. And to go through something like that alone and not come out the other end with some residue of emotional, dysregularity, is very unlikely. So a vulnerable group is somebody who's going to be on their own, regardless of how strong and able and big they are. No one should be on their own, or even regardless of, the infrastructure, how strong their house is. Yeah. Every storm is different.
Yeah, it is. Great conversations. Great timing to have this conversation too, by the way. And we're going to be back with more, of course, on a great topic around World Mental Health Day. And of course, we are here with a very special guest. We're going to reintroduce her again to the listening public, because we always know we have new listeners that come on at every different time. But keep it locked. We are going to come right back. It is Bobo, 103.1 FM. If you have a message for us, don't forget, you can go ahead and hit that message icon, and we would love to talk to you.
The Health Services Authority has over 120 world-class physicians, offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI-accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
Welcome to the show. It's Bobo 103.1 FM. It's Dane hanging out with you here. Don't forget, you can always message us on our social media, Facebook or Instagram at 103.1 FM. It's Bobo. You can hit that message icon and get in touch with us. We have a very special guest from the HSA today. She's going to reintroduce herself to the new listening public. The floor is yours.
Thank you, Jane. So it's Dympna Carten, Community Psychiatric Nurse at Health Services Authority. Pleased to be here this afternoon. Hope you're enjoying the program.
Absolutely. You're well known to because you've been in this industry for so long, so I'm pretty sure half of our listeners know exactly who you are. Now, we're talking about World Mental Health Day. We've broken down just what it means, what the theme this year will be, and, of course, critical concern for humans that are suffering with certain emergencies, particularly here in the Caribbean. And also, one of the things that we want to touch on now really quick, what are the main challenges, I would like to say, delivering mental health support during these emergencies and SIDS? I think this is referred to as SIDS/Caribbean.
Yeah, so there's small island developing countries.
Oh, wow. Okay.
Yeah.
Thank you for breaking that analogy down.
Yeah,
Yeah.
is what I understand them to be. So, yeah, there's several interlinked challenges for sure. And, you know, the biggest impacts are disruption to the healthcare infrastructure, right? Facilities may be damaged by disaster. Communication, power, transport may be down. Staff may be displaced. You know, the World Health Organization notes that emergencies significantly disrupt health services, but in particularly, you know, mental health services and the availability of quality care, which is why it's so important that we have a plan in action and that the Health Services Authority has plans in action to address those issues.
Love that. Okay. All right. So that answers that question. If you have any more that you would like to get more details about that, because that's new to me. You know, I just found that one out. So that's very new to me. So thank you so much for elaborating more on that. Sure.
Well, I'm speaking in particular to, you know, continuity of care in the aftermath of a major disruption, right?
Yeah.
Whether it be a hurricane, an earthquake, whatever. So that's why emergency medical shelters are so important.
They are.
So we know that there are 15 shelters across Grand Cayman and Little Cayman, right? Actually, I think it's two in Cayman Brac and there's one on Little Cayman. However, but there are specialist emergency medical centres. And what that means is the staff of the Health Services Authority have a cadre of professionals based in those centres, right? So they essentially have general practitioners, they will have a midwife, a public health nurse, general nurses, and then they also have a mental health professional. And what that means is that in the event, in the aftermath of serious disruption, if we cannot access the hospital or the islands are divided up in any way, that people can go to their nearest clinic, right? Their nearest emergency medical centre, and they will be able to get continuity of care and they will be able to be assessed and treated accordingly. So they're not just there for during the storm, they're there for continuity of care afterwards. And of course, you know, the Health Services Authority now also has, you know, a dialysis unit down in the West Bay Clinic.
Yeah.
So we have two units there which are able to assist. But they have many plans in place and they reach out to patients who are on dialysis, right? They encourage people to stock up on their medication to ensure that you have at least 2 weeks in stock. And this isn't just for general medications. It's also in respect of people who may be on medication for your mental health, that you may be depressed, you may be anxious, you may be suffering from, you know, a psychotic disorder such as schizophrenia or so forth. So we encourage you to make sure that you've got your supplies in, but in the advance of anything happening, reach out to your trusted professional and have that conversation and make sure that you're up to date with everything.
Absolutely. This is such an important topic too, because, you know, I was having a conversation with my son yesterday. So it's good for schools. It's good for companies to acknowledge things like this, good for medical centers, good for, like what you said, shelters because of the climate that we're in right now, hurricane season. But my son is actually in a sports school in Cleveland. And, he was telling me, Dad, one of the students was telling me last year they were at school because in Cleveland, Hawaii, it gets really cold, starts to snow. And a lot of the times the kids, it gets so bad because of blizzards and storms that they're not allowed to go to training.
Yeah.
And this sometimes can last for a week.
Yeah.
So what he found that a lot of the kids were suffering with depression that they didn't know they had because they were locked away from their sports. They were locked away in a room where some kids may think it's a fun place to be.
Yeah.
Because it's like I could play video games, but how long can I do that for? Or how long can I watch my series over and over for?
Yeah.
Until I start to feel this funny feeling like something is going on with me. So it's a very important topic.
It's a very important topic. And I want to say also that, we need to, some of the challenges have been in other places. I wouldn't necessarily say in the Cayman Islands because we are integrated into primary care systems. So a lot of our patients have very good relationships with their GPs. Yeah. And GPs are trained in mental health and, able to deliver that care, able to assess. And they will refer on accordingly if they feel it needs a more skilled individual. But we have, and that's why the role of the community psychiatric nurse is so important, because we work alongside those, GPs and the general practice. But the cultural stigma can be a problem, right? And in particularly in the aftermath of something big that has happened, people like to put on a face. They like to show that I'm good, I'm strong, I'm able. Yeah. But actually behind it all, they could be like that swan on the pond and their little legs are going hell for leather because they're not coping at all. And I think that in the aftermath of any terrible situation, right, that has a big community impact, people will come together and they will galvanize efforts and hope and strength and support. But at some point, depending on what you're also having to deal with at home, because your infrastructure, you may be living under a tarp, right? You mightn't have any electricity. You mightn't have any water. Yeah. You might be in a relationship at home that is less than comfortable, right? There may be alcohol or drug issues. There can be a number of things at play. So people can feel very uncomfortable about speaking about this. So we need to encourage people all the time that there are resources available. There are people that you can talk to confidentially. And I remember in particular after Hurricane Ivan, and at that point I was still going back and forth to the BRAC, working 2 days a week. And I came in one evening, and it was in the old days when you had to go through there was someone manning the booth. Or maybe it was because the electronic thing, I can't remember. Yeah. But I dealt with a member of staff there who was working there that evening, and they didn't seem very well mentally. They seemed very distracted. They seemed very tearful. And I simply said to them, and they would have recognized me from my weekly trips in and out of the airport. Yeah. And I don't know if they knew I went to the Sister Islands. And I said to them, "Are you okay?" It was as simple as that. And they said no. And I said, "What's wrong?" And they said that they hadn't slept for days, that they were feeling very anxious, that their heart was beating hard, and it was a real struggle to come to work every day. But they showed up because they needed the job and they had stuff to do at home. So I said to her, "Okay, this is what we're going to do. We need to get you some sleep. What I'm going to do is I'm going to ring the ER department right now. I'm going to take your name and I'm going to speak to one of the doctors and the triage nurse, and I'm going to say, I've just seen a lady and I'm asking her to come down to see you. She needs help and she needs something to help her sleep. And then what we will do is we will follow up with her in our clinic and we will see that she gets the support she needs, right? And get her on the right track." And that was as simple as that. Yeah. But for someone to actually go and seek that help, they weren't in a position. It's almost like people are stuck in mud, to acknowledge that this is an issue and I need help. But sometimes thinking that this will pass by itself doesn't always. And then what happens is it tends to morph and grow and it just becomes more disabling.
Seen it more often than I should, to be honest with you. People, please acknowledge that testimony that she just gave, which is a big one. A lot of you are hanging on because of your jobs too. Yeah. You mentioned an important one. Your jobs. When you can actually take time off from that. Doctors can write you letters.
That's right.
To get out of that. It's not a get out of your job, but it's like taking care of you so you can be good for your job. Skipping a few questions here, only because of a matter of time. How does the climate change disaster risk context of SIDS, specifically the Caribbean, affect mental health in particular ways?
Okay, well, we know that we face a disproportionate exposure to climate-driven hazards, right? Sea level rise, extreme weather events, coastal erosion, right? We've seen that in Cayman Islands, right? There's food, there's energy increase in prices. This affects us all. We look at the sargassum, right?
Yeah.
That's actually quite worrying.
It is.
And when you look at all the things that people say, well, you can't do this with sargassum because it's been fed by chemicals, right? So it's not as simple as thinking, oh, we can use it for something other now, because there's opinions out there that actually it's not very safe to use for other things. And people talk about plastics, right? These minuscule pieces of plastic.
Yeah.
But that's very distressing for people, particularly people in the tourism industry that tourism is their livelihood.
Yeah.
Right? And we certainly saw that, in the aftermath of Hurricane Paloma on Cayman Brac, when a chunk of the community there is fueled and fed by the tourism industry, right? The hotels, the restaurants, the little guest houses, the dive industries.
Yeah.
I mean, and and so much. There was so much destruction on Cayman
Especially
Brac.
after the pandemic.
Well, there you go again. So you can see how this does make people fearful. It makes people frightened. It can actually sometimes stop you from progressing because you think, what's the point? It'll not work anyway, right? So it actually, and then of course with the increased, intensity of the storms, these are all things that affect us, both physically, psychologically, and socially as well. Dean.
Absolutely. One of the most important questions I do want to ask, it's a very important one. In your role that you currently have, what do you think are some of the key messages you would want to communicate to the public ahead of a disaster? Because we're in hurricane season.
Mm-hmm.
And for a while, a lot of storms been taking a northward approach and getting away from us, which was, feels really good. But now we haven't been that lucky. It seems like some are popping up even closer and causing some anxieties.
Yeah.
But what can individuals, families, and communities do to support mental health from your point of view?
Well, I would first and foremost say, right, that, we have, and the people of the Cayman Islands and the visitors and all the residents, we've been dealing with the impact of weather for many years.
Yeah.
This is not a new thing. It's not today or tomorrow.
Absolutely.
We can look back to documented storms, particularly the 1932 storm, right? When people wouldn't have been prepared. But sadly, over 100 people died in that. And, many of the houses, I think, on Cayman Brac at the time were wrecked, were trashed. But people's resilience kept them moving forward. But I would say that there's some people who probably still experience, that residue from that. But I think what's really important, is that people have a plan, that they're aware, that you don't dig your head in the sand, right, and think it's not going to happen to me, because again, it goes back to you don't know. I would say that be mindful of the resources that you have in our community, right?
Yeah.
Be mindful of the resources, particularly that the Behavioural Health Department and the Health Services Authority have. Now, if you are someone that you maybe it's just a little nagging feeling that you've had, that maybe you don't sleep so good, you feel a little bit of anxiety, you feel a little bit stuck at times, but you've never really had it assessed, you've never had it addressed. Can I encourage you that you actually look to doing something about that right now?
It's important.
Exactly. And start off with seeing the general practitioner, right, at one of our Health Services Authority clinics. Because number one, this could actually be caused by an underlying physical condition, right?
Yeah.
It could be a thyroid problem, right? It could be related to sugar. It could be, there's many things that could be happening, right? So make sure that physically you're okay. And then have a discussion with them. They can refer you to the Behavioural Health Department or to one of the different groups of professionals there that you can see, that you can meet with confidentiality, right? And you can discuss these things. I would say if you're concerned too about any relative, any friend, don't be frightened to have that conversation with them.
Yeah.
And ensure that they're aware of the facilities and the help available. And, there's a large number of things that they can do. There's the Cayman, the mental health helpline, for example. You can completely call there anonymously. You don't have to say who you are, who you're for, where you're from, just that this is a concern I have. They're there to listen. They're there to help you and point you in the right direction. I would remind people also, of the counselling centre. There's a free resource. Yeah. But, what about, for people who are engaged in, faith-based institutions, right? Yeah. And attend church on a regular basis. reach out to your pastor, have that conversation, to a fellow church member. Don't be frightened, to be open and honest about what you're feeling. It's very important.
It helps, man. And all the leaders too are part of that entity that you're with, right? Because sometimes you're unable to reach the pastor at times, but that's why all the leaders are there too, to play his role too, right?
Yeah.
All right. So, one of the things I think is really important is during an emergency, that we have certain strategies that has to be put in place. Corporations have done it for making sure they take care of their assets, their products, their employees. A lot of times, less mental health is not really mentioned in a lot of large corporations. But how important is it to make sure that we continue to care of pre-existing mental health conditions? How important is that to make sure that doesn't stop because we are in the middle of a storm or about to encounter one?
Yeah, we have to take care of it. We have to continue to nurture it because it's like anything. And very often, in my experience, and having dealt with many people who have been diagnosed with various mental health conditions, right, and disorders, is that we get them engaged in treatment. They start the treatment, they become really well. And then guess what? They become so well that they say, I don't need this anymore because I feel good.
Yep.
And then you have to work with them and say, no, it's because you're feeling good. It's because of the treatment. So it's very much like treating, hypertension, treating diabetes. We can get you to a level where you're stable, but chances are you will need to continue that treatment. Yeah. Now, sometimes, and this is again something I've experienced across the years, is that when people are abusing alcohol or using illicit drugs, we can get them well, but they need to stop the illicit drugs, right? Yeah. Because that can trigger it. I have some of my patients that I know so well. I know when they're starting to use drugs again because they become a little bit paranoid. They become sometimes a little more grandiose. And then what happens is the insight lessens and it's like, no, I don't want to take this treatment anymore. So we have to work very closely with our patients. And that's, the beauty of being a community psychiatric nurse is that we work in a very unconventional way.
Yeah.
We go into people's homes because I think, we were talking earlier about how people present. I can come into you in a clinic and I can be dolled up and looking sharp and fresh and great self-care. And actually, what's happening at home may be a very different picture. Yeah. I get into people's homes. I get to see the challenges. I get to see the needs. And then again, because, we're very fortunate now at the Health Services Authority, and in particular in the mental health department, that we have 2 social workers, right? So when we need further assistance with social needs, right, because these are things that impact mental health as well, these challenges, we can refer or we can reach out and get people help and get them moving forward in a more positive way. But we must take care of our mental health because if we don't, the chances are, all those little wounds that you were suffering from before, they will come back. They will rear their ugly head and sometimes they can come back with an even bigger vengeance if, you've been challenged by further stressors in the meantime, because this is life and life is full of challenges and stressors and its beauties and joys, but we have to keep going because that's what life is.
Yeah, it is.
Yeah.
Very powerful conversation that we're having here. We're going to take a quick commercial break. When we come back, we're in the middle of wrapping things up with some very important questions to add into this very, very important topic around World Mental Health Day. Keep it locked. We are Bobo 103.1 FM.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
All right, welcome back to Bobo 103.1 FM. Thank you so much for tuning in. And we are at the last segment of this wonderful topic that we're having, educational topic, World Mental Health Day. And this is it's going to be going down. When does this actually take place, by the way?
It was the 10th of April. Sorry, the 10th of October.
October, yeah.
Yeah.
So we've been in for the whole month.
Yes.
The whole month that we've been a part of it. Okay, wonderful. I think one of the questions I do want to ask before I ask you, just reintroduce yourself to the public again. You don't have to make it all long. It's all good.
Okay, cool.
Yeah.
All right, so my name is Dympna Carten. I'm one of the community psychiatric nurses at the Behavioural Health Department, Health Services Authority. And also as a little thing too. I'm also the mental health lead in the National Emergency Operations Centre, and I'm in that role because of my role at Health Services Authority.
Talk about how important that role is, please.
That's a really important role. And actually what happened was, so some years ago, I was asked to do some training with PAHO in Barbados. And it was looking at developing a strategy and an emergency team that would address mental health needs, so psychological and emotional needs in the aftermath of any devastation, of any national event across the region. So anyway, off I went in the training, and it was a great bunch of people from all the Caribbean islands, actually. So it was really fantastic networking. I felt very much a part of the Caribbean. It was wonderful. But anyway, they said to us when we left, they said, right, what you need to do now is you need to go back to your country, to your island, and you need to find yourself a seat on the National Emergency Operation Plan. And I was like, how in the world am I going to go back, little me, go back to the Cayman Islands and tell government and, the hazard management that I need a seat at that table? They're never going to take me seriously.
Yeah.
Well, as luck would have it, as soon as I got back, there was a question that had been raised about mental health in the hurricane shelters and what provision had been made. And someone in the Ministry of Health at the time said, oh, you need to speak to Nurse Dympna, she'll know all about that. Sure enough, Danny Coleman, being the very efficient lady that she is, got on the ball, invited me to a meeting with hazard management and some other players. And within 15 minutes, everything was answered. Yes, we have mental health provision for this. This is what we do, and so forth. And then, of course, little did I know it, but the earthquake happened. And before I knew it, it was like, okay, Dympna, can you do this? Can you do that? And before I knew it, then COVID happened. And I ended up in this position very seamlessly, actually.
Important one.
And I'm not sure that the other countries across the Caribbean have been so fortunate in their in getting a seat at that table. But the great thing about this is now that it is very much embedded in the Cayman Islands, disaster planning and management. And we have a seat, we have a voice at that table. And I work with my colleagues in the behavioural health department, with my colleagues at the counselling centre, with the employee assistance programme, with other NGOs like, the Frontline Chaplains Association with Pastor Winslow. So we are growing all the time. And what this means is that it's not just that any sort of disaster per se, but recently with the search and rescue, Cayman was very much there. There was mental health at the table. Yeah. But I was able to reach out to colleagues across the board and our volunteers and say, look, we're here. We need support for family, for friends who are helping in this search and rescue. Can you come? And we had a tremendous turnout. So these are ways that we come together and that we pull. So yes, it's very important. And, it's also very important in that, that we do educational things, right? That we encourage people how to address, how to be more resilient, how to prepare for these events, right? Because we know that the key is forewarned is forearmed. If you're not prepared, you've got a greater challenge to source things. So yeah, a long answer to a short question.
No, it was a good one. It's important for us to notice, and I know you spoke about this in the last interview, and we always wanted to know about that role because we spoke off air. Yeah. And we always said that this is important for the public to know, right? Can you give that number too for the hotline services too, by the way, please?
Sure. So the number for Cayman is 1-800-534-6467. And that's operational on a Monday to Friday, 5 to 11 p.m. But of course, in the event of a natural disaster, of a storm, of a hurricane, that line will open up and run concurrent with the event.
Amazing. Thank you so much. Now, just in a matter of time, I want to touch on one important question here, and that is let's talk about the children and families. Yes. What are the special considerations for children in emergencies, and how can parents, as caregivers, help them with their mental health?
Well, it's really important, right? So we have this conversation now, right? Don't leave it to the last minute. So I would hope that every parent across the Cayman Islands has already talked to their children about, we're in hurricane season. What can we do? We may have to leave the house, but that's okay because we're going to go somewhere safe. And one of the things, and this ties very nicely actually into the mental health emergency support team on NEOC, is that we have also, my deputy is Dr. Shannon Seymour. So what we have looked at doing is in the shelters, we've actually put together a little book, a storybook, which we're going to have laminated, that we disseminated across all the hurricane shelters of the Cayman Islands. So it will explain to the children that have to go in there, this is where you're at, this is what's likely to happen. You are going to hear some noise. You are going to see some rain, perhaps. There may be loud bangs, but it's okay because you're in a very safe building. Yeah. This is a very safe building, and the Cayman Islands government are very good at looking after all their people. Yeah. But to get them included so they can take things with them into those shelters, or if they're going to stay with different family or different friends. And on that note too, there may be some families who are separated, right? Yeah. Kids live with mom but go to dad at the weekend, or, who knows what those changes might be. But have that conversation with the other key players involved. Don't leave it to the last minute to say, well, can you take them because, I can't. Yeah. And also to ensure that they're going into an environment that is safe, right? Not just that it's safe from the environment, right? From flooding, from wind, but also that, is there people in the vicinity, in that neighborhood that you may be uncomfortable with? We have to think about these things very carefully. But, in the interim, it's very important that they're well fed, that they're well nourished, that you stick to their routine and that you acknowledge any changes, but do it in a way that, try and do it as casually as possible, right? Not to make a big drama out of it. When you're sitting down, having dinner with them, having breakfast, doing the bedtime routine, just say, is there anything that you're worried about? This is what we're planning to do. Yeah. And take any concerns that you have seriously. If you feel a change and you see a change, don't wait, talk to someone about that. And again, reach out to the Health Services Authority, to the Behavioural Health Department, just have a conversation with one of our staff.
I love that. Absolutely love that. Now, we're coming towards the end of the show, and there's two things that I want to touch on, two things I mean in that this question here that we're going to ask the last one, but also anything else that you need to add in that's very important. We are in hurricane season right now. When the hurricane season hits and a major storm is forecast, what mental health preparation should individuals undertake?
Oh, okay. So again, it goes back to that emergency plan, right? We are currently watching, Melissa, out there. We're not quite sure what track it's very uncertain at this minute, but it's certainly going to bring us some rain, some wind. There's going to be changes with the sea. So what plans are you making? Where are you going to go? Are you going to be on your own? If you're an elderly person, or if you have elderly neighbours or friends, or you're concerned about someone, please have that conversation with them. If it is someone who is there with a helper as well, regardless of whether the person be elderly or they might be having some acute medical needs, make sure that you have that plan. Do not leave, the carer there by themselves thinking that they can cope, because again, you don't know what their challenges may be. So please have that conversation.
Thank you so much. We'll see you again very soon.
All righty.